On Thursday, with a 5-4 vote, the Supreme Court upheld this piece of legislation, the Affordable Care Act, also known as Obamacare. We at the Daily Advertiser wanted to know how the people of Lafayette felt about it. Take a look at some of our reactions.
Providing health care to everyone is the most important thing. If we can save one life by having someone who was diagnosed with cancer and told that they couldn't get insurance, then we've helped. You know, I mean, how can you deny someone life-saving care in this day and age?
Joe Myers, a volunteer with the American Cancer Society, views the Affordable Care Act as a step in the right direction, especially for Louisiana.
We have a lot of uninsured or underinsured people here in South Louisiana. A lot of our people don't go for their screenings because they don't have the insurance to cover it. So this Affordable Care Act will really help, because now mammograms, pap smears, colonoscopies will all be free of charge.
Glenn Craig of LSU Health says he expects for business to be the same as usual, but with additional patients.
LSU physicians have been traditionally very involved in the Medicaid program and do treat the Medicaid patients. So we expect to see a lot of the patients that we have continued to treat over the years continue to come to us, and hopefully there will be able to provide some additional care for patients who haven't been coming to us in the past, who haven't been receiving care anywhere.
Some that are opposed to the act feel as though it oversteps certain boundaries.
I don't think our government should be the one that's paying out of pocket for everything, especially for things that go against people's religious choices.
If the act funds birth control, Connolly is not in favor for a very specific reason.
Healthcare mandate in some parts is paying for abortions and birth control, and we as Catholics believe that that is morally unacceptable.
This college student is looking at the advantages in terms of access to medicine.
I'm for it because it's a great opportunity to help Americans, like when they need service of any type, because there's a lot of Americans that went through things and they could not be covered. They couldn't get the medicine that they needed. I personally went through that at one point, and now I'm with a private insurance that's there to help me when I need it.
The Lafayette Community Health Clinic, which provides free care for the working uninsured, is in the process of figuring out what the act means for them.
Talks are in place about serving the underinsured as well, and what insurance means for people. And not everything is covered by insurance. And so we're dialoguing as a nonprofit on how to best serve our community of Acadiana based on what is decided with the health care reform.
The discussion about the Affordable Care Act is far from over as it now moves on to Congress. As the story develops, the Daily Advertiser will keep readers informed.